The Kalamazoo Community COVID-19 Update is produced locally through Public Media Network.
Good afternoon, and thank you for viewing. This is Clifford Brown, and we're back with the Kalamazoo Community COVID-19 Community Update. We are blessed and honored to have with us today Stephanie Moore. Stephanie is and I'm sure everyone knows this, but Stephanie is the Kalamazoo County Commissioner. And as I recall, you're over District 1.
Yes.
Right?
Yes.
How did you work out that number one?
Well, you got to walk in it. When God calls you first and not the last, you just got to be ready for it. So District 1 is the urban community in the city of Kalamazoo. We have a great diversity in our community. It is actually the north side, east side, downtown, and a small portion of the lower part of West Main. And so we're very diverse and inclusive. We have hardworking individuals here. We have a large number of homeowners, employed individuals, and we also have the working class and working poor as well too. But our community here is strong. We're together, and we're actually glad to be counted as one.
There you go. So that's quite a big territory.
Yes.
Let me ask you, as commissioner, what are your responsibilities?
Our two main functions as a commissioner, once you're elected, is to actually balance a budget every single year. So we work together, we work with administration to make sure that every department under Kalamazoo County Government Authority has a equal and balanced budget. So that includes Health and Human Services, the courts, the sheriff, the prosecutor. That includes the parks, county parks and recreation, everything that falls under our local government, community mental health. So we make sure that all of your tax dollars are accounted for and they are appropriated to where they need to be. The other thing is policy. We come together and we vote on the business of Kalamazoo County as it relates to all of those various departments. And we make sure that our administrator, or I should say we support our county administrator as she oversees the implementation of all those policies, programs, and directives that are literally voted on by the full Board of Commissioners.
Wow. Does that include a 24-hour workday? Because it certainly sounds like one.
Absolutely. So, all of us work full-time jobs and we all do everything we can for the county commissioner. I am more of a hands-on. I'm very much in the community. I'm listening, I'm touching, I'm talking to people in the community. And what I hear and learn, I take it back to county government. So when I'm in that room and we're making decisions, I'm really conscious of the barriers that people face, the needs of the community, and how we actually put it into practice so that it works, not necessarily from the top down, but from the bottom up.
Excellent. Well, you brought up an important word, and you said conscious. And recently, I saw that I want to get the elephant in the room, and for me, that happens to be the COVID-19 protest that we had in Lansing yesterday.
Yes.
And
a bunch of, so one thing that I have to say is I do pride myself on being open to people that I may not even disagree with, but a lot of times you can learn some things by just paying attention and, like you said, being conscious. I can tell you that I was very dismayed and very hurt at the fact that these individuals came together, number one, in a way that could potentially spread this disease even more, that it could even cause more harm to the people who are on the front lines, having to deal, who don't have a choice, that they have to go to work because they're essential employees. And when I saw the children that were there, that was learning and literally soaking up this negative energy, this hate, this disparaging treatment, and those toxic words that they were spewing, I thought to myself, oh my God, what about the children? Can we do better in teaching and being an example for our kids? But then I got angry, Clifford, because I felt like apparently these individuals are someone who have lost someone due to this pandemic. There aren't someone like me who had to send a loved one to the hospital, and I couldn't even go in and be with that individual to help them, to advocate for them, to support them through trying to overcome this coronavirus. These are individuals who simply either don't know or they don't care. And that's very troubling for me. And to take the hate and the bias and just, all this negative energy that they had, and to give it not only to our governor who is trying to fight for our lives, but to also put that on us as a community, that wherever they went, whatever they touched could have easily contaminated us, not just with their hate, but with this infectious disease.
Yeah, well, I had a lot of emotions going as I saw that. And I tried to narrow it down. And, the one thing I thought about was understanding, understanding how it's transmitted, understanding the impact of them being in public. But most importantly, I wondered about their adherence to the stay-home order.
Mm-hmm.
If you would, for the viewers that are paying attention to us or that have logged in, explain what that stay-home order means and why it's important.
So definitely the stay-at-home order really means that this is an opportunity for you to take advantage of doing some things that could potentially save your life, that can help you stay healthy and well, and could potentially keep you from succumbing to this disease. And basically what the governor is asking of us as a community is to stay at home, is to continue to wash our hands for at least 20 seconds all the way up to our wrist so that we can stay sanitized, keep our hygiene good. She's asking us to do social distancing, which means that we should be at least 6 feet away from individuals as we're making contact with people, especially for those of us who can't stay at home, that are essential workers, that have to be out in the community. She's asking us to wear a face mask, which of course, I have mine. So make sure when you go out,
a face mask.
when you go out in public, in the community, to the grocery store, to pick up a prescription, wherever you go, to the gas station, make sure that you are covered up, because we know that this virus is airborne. So we want to protect the health and the livelihood of everybody. I want to be more specific to your question when you say, what does this mean? And I want to say, what does this mean to us, to the Black community who are more vulnerable to this disease? And not because we're disobedient and we're not staying at home, but because we are on the front line. We are the ones who's holding up the structure of the community, the infrastructure of this country. When you talk about transportation, grocery workers, factory workers, assembly folks, first responders, nurses and doctors, the folks that are driving the ambulances, we are right there on the front line driving the public transportation to get people to where they have to go. And not only are we the essential workers on the front line doing that work, that when we're finished, we go back to our communities, back to our homes and our households, and could potentially cause some type of infection to our loved ones. And even the community coming, stopping at the store, the grocery store, getting Pampers, getting formula, doing the essential things that we need to do. And when you look at African Americans who have the highest rate of health disparities, which means that we have the highest rate of heart disease, cardiovascular disease, diabetes, obesity, cancer, upper respiratory infections, that makes us even more prone to be ill from this disease and even to succumb to death. And that's why it's important for us to pay attention to what's happening, to follow those directives of the governor, of our local county health departments, and to stay at home for as long and as much as you can. And when you can't stay at home, to wash, social distance, cover up with your mask, and to check on your loved ones, making sure that the people who cannot stay in, that they're doing okay mentally, physically, health-wise, and that if they need some assistance, help them, support them, and get them what they need. This is serious. This is real. And we have an opportunity to show our resilience, if you will, through this pandemic, but we got to be smart and safe while doing it.
Absolutely. Absolutely. You know, I had a conversation with the director of, let's see, it was the director of infectious prevention.
Oh, wow.
And one of the things that he stressed throughout our conversation was risk factors.
Mm-hmm.
You mentioned those when you talked about diabetes, when you talked
Mm-hmm.
about hypertension and COPD, and
Mm-hmm.
all of the other illnesses that often are common in our community.
Yeah.
So, you know, the question that I have is, how is that stay-home order impacting us? Are we adhering to it? Um, and what is the end result for our daily lives?
So I think for the most part of it, we are adhering to it. I think that, like I said earlier, you got some folks who just cannot stay home, that they have to be out. I think that we have some very vulnerable people in our community that definitely adhere to this. Our seniors, our elders, those individuals who are already sick and are dealing or living with mental and even physical challenges, that although they may not be going out, they may have loved ones who are going out, whether if it's young kids who want to play and be out in the community, whether if it's close family members and relatives that are working, or family members and relatives that are coming to their homes and checking on them. And where the issue may come is when we get people, just because we know and love them, we have to stop them at the door. We got to make sure that they wash and they sanitize. We got to make sure that they're wearing their mask. And we got to make sure that they have followed enough steps to protect themselves so that they are not endangering us. I have a 78-year-old grandmother right now who's fighting for her life in the hospital, who has not been out of her home in almost 2 months, but because she have other people in and out of her home, that has put her at a higher risk. So we have to be conscious of that and know that just because we're doing what we're supposed to do, that doesn't necessarily mean that everybody else is. So sometimes when people knock on the door, you got to talk to them through the screen and say, hey, thanks for coming by. I'm okay, but I can't let you in.
I understand. Yeah, that brings up an interesting point, because not just in our communities, but across Kalamazoo County, we've got older members of the communities of our society. How do we care for them, knowing that they're adhering to the stay-home order, but they have the needs that we have?
I think that care definitely looks like reaching out and touching. We got to go to the old-fashioned way of calling people. We're used to talking or texting and Zooming and email and all that stuff. We got to reach out and touch. We have to call our folks. I've had to make a lot of house calls, and I went and I knocked on the door and have done some welfare checks. I didn't have to go into the house, but they were able to say to me, I'm okay, this is what I need, and I can deliver those needs. I think that we also need to make sure that people are connected to community-based organizations that have the resources like food, medication, delivery services that they can have access to. And people can call 211, and from a landline or from a cell phone, you can dial 211, and that can connect you to all the resources, where to get free food, free Pampers, free milk, whatever you need. The organizations in Kalamazoo are prepared to help meet those needs. And then I think we got to make sure that people understand that this is a stay-at-home not to punish you, it is to protect you. That this is about life and death, and that we have to have these conversations, these kitchen table conversations with our friends, family, and loved ones, even where we worship, where we go to the grocery store, to understand that if we don't have to do it, then we shouldn't. We should stay at home as much as possible.
I agree 100%. You brought up an interesting point, and I swear you must have 26, 27 hours to your day where we have to report. I know that
you see the bags under my eyes.
I don't, and that's amazing. That's a very good thing. But I know that you work with a number of resources, and for our viewers, for our audience, if you would please go ahead. Let's talk about some of those and some of the good things that you're doing. And let's finish up with in that section, or with that question, with how we can reach out, we can find those, we can get help when we need it, because there are 96% of us across this country that are not working. And,
Yes.
and I know that you're doing a lot to make sure that our needs are taken care of.
Absolutely. So I work pretty much full time for a nonprofit organization called Mothers of Hope. We're located on Ada Street on the north side, right in the heart of the community. And we have a pilot program that we just launched today. And it's called our Shakita Quana Lewis Laundry Card program. So individuals who are at home and they have children at home and they're struggling trying to keep up with all this laundry, we know that hygiene plays a huge part in the reduction of the spread of this disease. So we are going to be giving laundry cards, detergent to individuals to help them meet that need. The other thing that we're working on is giving free, no, I shouldn't say free, a $25 credit to Lyft. For those individuals who are essential service workers, they got to go to the doctor, get prescriptions or whatever. If you contact me and you complete a really simple survey, I can definitely get you hooked up with a $25 credit to go on your Lyft account. And that way, when you're calling for a ride, we can help you ease that financial burden. How you get access to these services is by doing a survey. And the survey, Clifford, you can call 269-218-8585, or you can text that same number, 269-218-8585, and just text hi, and then a survey will start. It'll ask you for your name, your address. Are you sick? What are your symptoms? Did you have to go to the doctor? Did you request a coronavirus test? Were you given one? How were you treated? And then, of course, the last question is we ask people, did you complete your census? Did you do your 2020 census and send it back in so that you can be counted? And so in order to access the laundry cards, the Lyft credit, just text that number 269-218-8585, and we can get you started there. The other thing that we're working on is making sure we're doing educational outreach and forums to people on how to apply for your unemployment, how to apply for the small business support, financial support. If you are a self-employed, if you're a 1099 person, how do you tap into the financial services to help you get over? We're connecting people to the resources that can help us maintain as we are not working or reduce working. We can have access to food. We're giving people information on how to get free food, especially for the kids that are in the public school district. So there's a lot of resources. The disconnect is people having access to that information. And you can get that through me on social media. I'm on Facebook, Instagram, Twitter, and LinkedIn, even Snapchat.
Okay, let me circle back, if I may, because you mentioned something that it seems like it could be an Achilles heel in our community, and I want to overcome that up front. You mentioned that there's a small bit of demographic information in terms of a survey that we would have to provide. Let me ask you, so that we can help our community stay at ease, what happens to that information?
That information goes exclusively to Mothers of Hope. We don't sell your information. We don't share your information. The reason why we have to capture the demographics is, one, we have to be accountable to the donor who gave us this money to distribute. And, anytime you're giving away money, you got to be accountable for it.
Absolutely.
The other thing is so that we can identify them in what's called the Voter Access Network, which we call it the VAN. And basically, that allows us to go into the VAN and know that these people have been contacted, and then that satisfies our requirements with our donors, basically.
And then
so
that
we
allows
don't advertise. We don't sell it. We don't try to sell you anything at all. Every program that Mothers of Hope has, they're free. And we're usually giving and donating to our community and not really asking, them to give us.
Excellent. And I'm sure that information, once we hear that, will help someone to say, I don't mind providing my information. Let me circle or move into a different area. One thing that I've seen across our nation is the subject of PPEs and inventories, and in some cases shortages. Let me ask you, how are we doing in Kalamazoo? What are you hearing? Are we set to handle any problems that we may have here in Kalamazoo?
We were not initially set. We were not equipped, prepared, or ready to adequately respond to this pandemic. And so it's been a fight. I've had the pleasure of working with the CEO of our Family Health Center, Denise Crawford, and leveraging relationships that we have on the state and national level. We've been able to secure more testing. We've been able to secure a testing site that's right here in the heart of the community. So starting tomorrow on Friday from 9 a.m. to 4 p.m., Family Health Center will be able to test more individuals for the COVID-19 virus. All you have to do is call Family Health Center. You have to go through a little triage. They'll schedule an appointment, and then you can just drive up. It'll be all drive-in, and you just drive up, you'll get your test, you'll get the test results in 24 hours. We didn't have that at all whatsoever. And so right now we're at 108 confirmed cases in Kalamazoo. The majority of them are people of color. Okay. Of the 108, 8 of those have died already. Which again, a high number of that represents people of color. But the truth is, Clifford, that's not even a blimp of the number of sick and or infected people in our community, because we didn't have enough tests to adequately test everybody, let alone enough people, so that we can have a real representative number of what this pandemic looks like locally. So you can't just say, oh, it's just 100 people. It's way more than that. So starting tomorrow, we'll be able to have more testing available. I want to tell you this about the testing. So it's important to know that once a person is tested, there really isn't a treatment plan. You gotta have to nurse this as you're dealing with any other virus. The only time that you're hospitalized is if you're having shortness of breath and you can't breathe and you have to be ventilated or to that extreme. Other than that, really, you have to go home, be quarantined, stay away from other people for at least 14 days, and just take care of your health. Unless your health gets really, really bad, then you have to go to the hospital. So I want people to understand that there is no treatment, there is no medication, there's no prescription. That this is about us being smart, eating healthy, staying inside, our hygiene, so that we can overcome or be resilient against this. So if you test positive, they're not going to hospitalize you unless you're critically ill. You're going to go home, you're going to be stayed at home, quarantined, and then you're going to have to nurse yourself back to health.
I see. Well, let me ask you this. You mentioned that initially we were not prepared, and I would expect that to be pretty consistent across the country. But I'd like you to do something for me, and that is, you mentioned that you've worked with a number of partners throughout the community, throughout the state, et cetera. Tell me that we are now prepared, and as a viewer, help me feel good about making a call or going in to get diagnosed, or if I need to be admitted. Help me feel good so that I feel like I'm going there for help, and I have the freedom to go there for help, and I know that once I get there, I will be helped.
I'm going to tell you this, is that we are right here. We are preparing. We are taking the steps necessary to get the adequate amount of resources, especially tests, so we can really respond to this epidemic. What I want to tell people is that this has been a work in progress. This is something that this community, this state, this country has never seen to this level. And so what I want people to understand is that if you are sick, take care of yourself. If you get a fever over 106, if you cannot breathe, then you need to call your primary care physician immediately. If you're worse than that, then I need for you to go to the hospital and call 911 to have an ambulance come get you if you have to. What I want you to understand is once you get to the hospital, you are there alone. No one can go with you. Mama can't go with the child. The husband can't go with the wife. You go in by yourself, you get triaged, and you go in for your treatment. What I need for you to understand is that you have to advocate. You are your own advocate during that process. So know your rights as a patient. Know that you have the right to ask questions. Know that you have a right to understand the treatment process and what's going on. Know that you can insist that the nurse, the doctor, the practitioner communicates with your family members so that they can understand where you are in this process if you end up being hospitalized. So I want people to know that this isn't an easy thing, that we're learning this as we're going. We're responding as appropriately. I want to say that for the most part, our healthcare providers are doing their very best. They are committed to providing the best service and healthcare that they can to people. But this is serious and it's real. So if you can prevent yourself from being sick and having to go to the hospital to be in that situation, I'm telling you, stay at home, wear your mask, wash your hands.
That's prevention.
The prevention. That's the only thing that can save our life right now is the prevention.
Okay. Now you mentioned a temperature of 106. I'm hearing like 101, 103.
103.
Okay. Okay. Very good. For what I know, we talk about prevention, we talk about stay at home, etc. What advice would you tell people that I see out and they look like, in some cases, that they have cabin fever and just want to get out of the house? I see a number of people out like that. Mm-hmm. Do you have a message for them?
Well, I would say that the governor has said that we should get out and get some fresh air. So walk your dog, take a walk. The social distancing is critical. So make sure you adhere to that. If you don't have to go out and be in places where there's crowds or a lot of people gathered, then don't do that. If you got to do individual stuff, do that, but don't go in crowded places. I would also say that it's important that you take care of your mental health. Being home, being quarantined and sequestered, after a while, it can get to you, it can get in your head. So do things like exercise, like walk, like read a book, call some folks. I think it's important that we see and have contact. So do Zoom or Skype or however, FaceTiming individuals so you can maintain contact with people. And if you feel like you're depressed, you have thoughts of suicide, if your anxiety is heightened, then call 211 so that you can get on the phone with a clinician, with a healthcare provider that can help you work through and manage this. I strongly suggest that people begin to do mindfulness things, to meditate, to practice breathing. Breathing is very important in situations like this. Learn how to really manage your stress levels. Learn how to do that on your own. Just in case if you call in a doctor and you can't get through and nobody can help you at that moment, we need to learn self-care. How do we take care of ourselves? Not just when times are bad, but even, day to day. And so it's really, really important that people understand that everybody is scared. We're afraid. We don't know the unknown right now, but you gotta be smart, stay safe, and you have to communicate, Clifford. This is the time where we need to be talking like, you know what, I'm experiencing this. This is what happened to me, and tell your story so that we understand that. And lastly, I want to say this to your point about possibly judging people because you see them out. I have a constituent. She is 76 years old. She's at Borges Hospital right now fighting for her life. She is a diabetic. She has a lot of other health issues, and she lives just 5 houses away from a local liquor store. And because she can't always afford her diabetes medicine, she manages her blood sugar by going to the liquor store and getting orange juice and treats periodically, some sweets to manage her what we call the sugar, right?
Absolutely.
And the store closed. There were people that were advocating for the local liquor stores to close. That put this woman at great risk. Mm-hmm. The weather got bad. She couldn't walk or she couldn't get to the main grocery store. The transportation is no longer running. And so she went days without adjusting her blood sugar. She's now in critical care at the hospital. So we need to really think about people and their situations and their circumstances. Give some folks some grace during this time. Absolutely. Understand that most people are conscious and they're only doing what they have to do to satisfy their physical and their mental health. Yes, ask people, check in with them, say, hey, bro, hey, sis, you all right? You good? you got to go home, but don't judge, don't criticize, and don't, force people to have more of the anxiety, the stress, and the depression that they may not otherwise have.
Well, and I agree 100%. And certainly I want us to expedite the process of getting over this as quickly as possible. But I do want to circle back on one thing. You mentioned one of the resources that you work with. Let me ask you, are there others within the Kalamazoo and Kalamazoo County that you would mention in terms of where people can go for help?
Yeah, so right now, there's a lot of groups doing work that's helping people. As you know, we have a moratorium on evictions. And so if you are behind on your rent, you haven't paid during this time, no one be evicted. They will not be foreclosed on. We are making sure that there are resources out there for a variety of different things. So I want people, instead of naming individual organizations, I want people to know 211. Call 211 if you have any type of issue, crisis, if you need any help, support, if you need transportation, if you need your prescriptions delivered to you, if you need food, housing, if your roof is falling in, call 211. The other number is 311. That number is through the city of Kalamazoo, and you can call back if you need help applying for some of the grants, some of the funds, the emergency assistance funding that's being available through the Foundation of Excellence to the overall community. So 211 and 311, those are the numbers that people need to keep. Write it on your refrigerator, keep it handy. And no matter what the issue is, call. If you're not sure where to start, reach out to a loved one or a friend. Somebody can get you to where you need and the resources that you need. And by all means, call me, text me, email me, Facebook me, whatever you need to do, contact me, and I'll do my very best to connect people to where they need to go.
Excellent. Well, I've got one last question, because I know that you're being pulled in a lot of different areas. There are many of us that are sitting at home and may be able to assist you, whether that be making a phone call to check on someone or what have you. How can we reach out to you in the event we want to help and check on those that at this point may not be able to get out or just need to hear a voice? How can we reach you?
So I think the easiest way for a lot of people that are online, they can definitely reach me on social media. I'm on Facebook, Stephanie Moore, Commissioner Stephanie Moore, Instagram, Twitter, Commissioner Stephanie Moore. I'm on LinkedIn. You can always reach me by email. My personal email address is Steph, STEPHNY, STEPHNY, the number 4, at gmail.com. You can also reach me. I'm going to even be nice and I'm going to give you my cell phone number. I got to find the number. I don't call myself that often. So I think this is it right here. You can always call me or text me, area code 269-993-7449. 269-993-7449. All of my personal contact information is listed on the county website. That's calcounty.com, KAL county.com. You can get my email, my phone number, everything right there on the county website. As elected officials, our information is public record. And so people can, usually people come and knock on my door. Don't knock on my door now.
I was just thinking, it's really a great testament to you to be willing to give out your information so that we can reach you. And I was thinking, wow, you just opened yourself up to everyone.
Oh yeah.
So, but that's phenomenal, because that means that you have broad shoulders and you're taking on the challenge. And if you'll recall, I mentioned earlier that Kalamazoo needs to hear from you, and that shows up as why Kalamazoo needs to hear from you. So
absolutely. I want to say one last thing to people of faith. that I know this is challenging even for those of us who are believers and that are worshiping. All church services, Bible studies are now online on Facebook and Instagram and YouTube. So I encourage people to check in there. This is a testing of faith going through this. And I also want to encourage people that are true believers, that give, that do their tithes and their offering, to continue to do that, to support the church, to continue to build, invest into the church. Because when I'm in modes where I'm trying to get things done, Clifford, that's where I start at first, as most of our churches, asking them to give, to invest, to support the community, to stop evictions and foreclosures. And they do that with the money that church members are investing into the church body. So please don't forget about our places of worship and helping to sustain them.
Excellent. Well, listen, I know my time is about up, but it has actually been, it's been an honor and a pleasure to have a conversation with you. I can understand, as I mentioned earlier, why you have the love in Kalamazoo, and it's because you give it first.
Oh, yeah.
I'd love to be able to come back to you at another time and let's have another conversation.
Anytime.
Okay. And you can give us more information this time. You gave us your phone number. Maybe you'll give us an address and we'll all line up at the door.
201 West Kalamazoo Avenue.
I thought you saved that for next time.
But yeah, and I want to thank you for your work and bringing this information to the community and allowing this forum for people like me to have access to. So thank you, Clifford. You're amazing.
Well, thank you. It's my pleasure, and I expect to be here. I'm hearing conversations about us reopening the country. I have some reservations about that.
We're not ready.
I wouldn't think so, but I have made the commitment that the Kalamazoo Community COVID-19 update will be there as long as we have a need.
Yes. Yeah. You're doing great work. We're proud of you.
Thank you. So with that, I will talk to you real soon. And again, thank you so much for giving us your time.
Absolutely. Have a good one.
Okay, you too now.
The Kalamazoo Community COVID-19 update is produced locally through the Public Media Network. Our goal in this and subsequent broadcasts will be to provide you with the most up-to-date local information concerning the health of you and your family throughout this most devastating pandemic. Our community is braced and consistently preparing to handle the medical, emotional, and social needs of our families and friends. Please adhere to the advice of our governmental and community leaders. They are working tirelessly to provide you with information that will make a difference. Our broadcasts are likewise poised to provide you with updates of when and where you can find essential resources. We hope you'll receive this information with the care and urgency necessary to keep our communities thriving. Please be safe and make wise decisions. Thank you.
Hi, I'm Zach with PMN, and we're going to go over how to practice good information to combat the COVID-19 virus. Something that we must do in these times is practice social distancing. Avoid gatherings of large people, keep your distance, and know that there are safe activities that you can do, such as taking a walk or a family game night. Here are 5 tips to double-check COVID-19 information online. Some stories are too good to be true. False and misleading stories spread because people share them. Not all research is created equal. Verify images with reverse image search. Verify videos with thumbnails and InVid. Use geolocation to determine where a photo or video was taken. Help is also available. For emotional support, call 269-381-4357 for the local crisis hotline, or call 1-800-273-8255 for the National Suicide Prevention Hotline. More information can be found on our website at publicmedianet.org.